Able to talk to you today. My perspective is as a public health physician who specialises in research at the interface between public health and transport, particularly active travel and physical activity. Based with the Medical Research Council Epidemiology Unit in Cambridge, I lead a programme of research which focuses on understanding and evaluating environmental and policy approaches to promoting a change in physical activity in the population as a whole. I will, in the course of my talk, be referring to some of our emerging findings from a couple of studies in this area. One of these based in Cambridge, the Commuting and Health in Cambridge study, which is focused ultimately on evaluating new public transport and cycle infrastructure. And a second study, iConnect, which is a study of a national programme of new walking and cycling infrastructure led by Sustrans. Now, while these studies are both ongoing, and I'm not reporting any of the evaluative outcomes today, some of the findings we are generating along the way will help illustrate my more general argument, which is, as you can deduce from the title, to try to encapsulate why I think active travel is an important topic for public health and for the intersection between public health and transport, and a little bit about how we might move towards a more active population in this respect. Well, physical activity is good for health. The latest estimate published in The Lancet earlier this year suggests that nearly 10% of global premature mortality is attributable to insufficient physical activity. Physical activity reduces the risk of diabetes, cardiovascular disease, and a variety of other chronic diseases. And last year, the chief medical officers of the 4 nations of the UK collaborated on updated guidelines indicating the amount of physical activity that is beneficial for health to which the population should aim. And in summary, for adults, the target is 2.5 hours of physical activity per week. Now, as the Minister has already alluded to, Health Survey for England data, which the Chief Medical Officers cite in their report, suggests that most people are not achieving this. And those data are based on what people say they do. Now, we all know we may be susceptible to some bias in reporting what we do when researchers ask us these questions. If we look at the objective evidence from accelerometers, which are devices that can be worn by a participant for a week to make an objective measurement of their activity over a week, those would suggest that the actual proportions achieving the targets are much lower. And while accelerometers do not capture all forms of physical activity, for example cycling, very well, it does suggest that the true proportion of the population who would benefit from doing more physical activity is very substantial. But how are we going to manage this? Most of us would find it difficult to do a lot of physical activity in our jobs. Most of us probably don't want to do more housework. And most of us have limited time to do more recreational physical activity. But most people do spend a lot of time doing this. So the average commute in this country is 28 minutes per day each way. And that suggests to me a large amount of time committed on a daily basis, which offers potential for increasing the proportion of time that's devoted to physical activity by means of walking and cycling. One of the current research questions in this area is, well, it's okay if we promote walking and cycling and people do more of those things, won't they just do less of everything else? Won't they give up going to the gym or do less gardening or whatever, go home and relax on the sofa to compensate for all the new effort of cycling to work? We and other groups are looking at this to try to assess the balance between active travel and overall physical activity. And our latest results, which I'm putting up here, are one from a series of papers looking at this. In the iConnect study, we followed people whose active travel has changed over the course of a year. This is in adults. So if we take as a comparison people whose active travel remains stable over the course of a year, that's the reference group, compared to those, people whose active travel increased over the course of a year made very little change to their recreational physical activity, and so their overall amount of physical activity increased by about a couple of hours a week on average. and those whose active travel declined over the year had a mirror image decrease in overall activity. So this and other studies are assembling a body of evidence that suggests that actually, yes, if we can get more active travel, that is likely to be translated into greater overall physical activity and therefore contribute to meeting the guidelines that I've outlined already. However, it's not just about active travel contributing to overall physical activity. There is evidence that active travel in and of itself is associated with better health outcomes. Now, one type of evidence to support this argument comes from comparing countries or other jurisdictions where there are different levels of active travel. Here's one example from a series of comparisons published recently from the United States, in which the proportion of adults who travel to work by walking or cycling, shown on the x-axis, is compared with the proportion of adults in those populations who have diabetes on the y-axis. And comparing both states, that's the solid black line, and cities, that's the dotted line, this suggests that as the proportion of active travel increases in the adult population, the proportion of diabetes decreases. This type of evidence is complemented by much more robust epidemiological evidence following individuals through time, which suggests also that active travel leads to better health outcomes over time. So, for example, in this systematic review published a few years ago, assembling a number of different studies looking at cardiovascular events as the outcome, the pooled evidence suggests that people who are active commuters were about 10% less likely over time to have a cardiovascular event. And that's after adjustment in most cases for their occupational physical activity and their leisure time physical activity. Another issue about the balance between active travel and other forms of physical activity is the carbon impact. One of the analyses we've recently published from iConnect looks at how overall carbon emissions from transport vary according to the amount of different activities that people do. So it probably won't surprise you that people who report more walking or cycling for transport tend on average to report less overall carbon emissions from their transport over the course of a week. Perhaps slightly more surprisingly, those who report higher levels of recreational physical activity tend to report more carbon emissions over the course of a week. And this presumably reflects the fact that a lot of that recreational physical activity is taking place somewhere else to which motor vehicles are being used to get there. So there are ways of using bicycles, there are ways of being active that have different implications for our carbon emissions. And active travel is clearly a win-win situation whereby it's replacing the use of fossil fuels. Now, one of the concerns about promoting a shift towards active travel is to do with the risk of injury, particularly in relation to cycling. And linking with that and also the carbon angle, I want to talk a little bit about modelling of the health impacts of scenarios that involve doing more active travel. And I'm referring here particularly to work from my colleague James Woodcock, who will be here leading one of the workshops this afternoon. Now, one of the landmark papers in this respect published in The Lancet in 2009 compared the modelled health benefits of several possible scenarios of ways of addressing carbon reduction targets. So in this analysis, the scenarios were modelled up until 2030 and looked at health outcomes related to these three domains relating to transport. The two scenarios I want to contrast are, one, a lower carbon vehicle scenario, in other words, addressing carbon targets by decarbonising the vehicle fleet. And as you can see, this has a discernible modelled effect on air pollution, but for obvious reasons not on physical activity. But compare that with the modelled health benefits attributable to an active travel scenario, in which it was assumed that there would be substantial increase in walking and cycling to replace many of the trips currently made by motor vehicle. This is in the context of London as the population modelled. As you can see, while the model assume that there may be a rise in the number of injuries related to having many more people taking to the roads on bikes, any adverse effect from that is hugely outweighed by the beneficial effects attributable to the increased physical activity.